Assalamu alaikum. I am Dr. Muhammad Faysal Hawlader, lecturer, Department of Anatomy, Eastern Medical College. Welcome to my very first online lectures, and today I am going to discuss about autonomic nervous systems. What do you mean by autonomic nervous systems? The nervous systems which innervates the autonomic structures of the body is known as autonomic nervous systems. What is autonomic structures? The structures over which we have no voluntary control is known as autonomic structures like heart, lungs, glandular secretion and smooth muscle. Autonomic nervous systems represent the visceral component of nervous systems in which cell body is located in both central nervous systems and peripheral nervous systems. What is central nervous systems? Brain and spinal cord together constitutes as central nervous systems. What is peripheral nervous systems? 12 pairs of cranial nerve and 31 pairs of spinal nerve with their associated ganglia is known as peripheral nervous systems. Anatomically, nervous systems is divided into central nervous systems and peripheral nervous systems. And functionally, nervous systems is divided into autonomic nervous systems and somatic nervous systems. Autonomic nervous systems is divided into sympathetic nervous systems, parasympathetic nervous systems and enteric systems. Enteric nervous systems is confined within the GI tract. It is also known as intrinsic nervous systems of GI tract. It has two plexus, mesenteric plexus and meniscus plexus. Mesenteric plexus is located into the muscular layer, outer longitudinal, inner circular, and meniscus plexus is located into submucous layer. Now, sympathetic nervous systems. What do you mean by sympathetic nervous systems? Thoracolumbar outflow is known as sympathetic nervous systems because the cell body of sympathetic nervous systems or cell body of preganglionic fiber of sympathetic nervous systems is located into the thoracic 1 to lumbar lateral gray column of thoracic 1 to lumbar 2 segment of spinal cord. What is parasympathetic nervous systems? Craniosacral outflow is known as parasympathetic nervous systems because each cell body is located into the brain stem in connection with the 3, 7, 9, 10 cranial nerve and lateral gray column of sacral 2, 3, 4 segment of spinal nerve. Now, in case of sympathetic nervous systems, preganglionic fiber is short, myelinated and release acetylcholine, and postganglionic fiber is long, non-myelinated and release noradrenaline. So it is also known as adrenergic systems. In case of parasympathetic nervous systems, preganglionic fiber is long, myelinated and release acetylcholine, and postganglionic fiber is short, non-myelinated and release acetylcholine. So it is also known as cholinergic systems. In case of sympathetic nervous systems, the preganglionic fiber is relay or synapse with the lateral ganglia, collateral ganglia and terminal ganglia. And lateral ganglia represents the sympathetic chain and collateral ganglia represents the celiac ganglia, superior mesenteric ganglia, inferior mesenteric ganglia, superior hypogastric ganglia and renal ganglia. And terminal ganglia is represented by adrenal medulla. We know that adrenal gland has two parts, adrenal cortex and adrenal medulla. Adrenal cortex has 3 divided zones and they release different types of hormone, and adrenal medulla is release epinephrine and norepinephrine. What is ganglia? Collection of cell body outside the central nervous systems is known as ganglia. And what is collection of cell body in central nervous systems is known as nuclei. In case of parasympathetic nervous systems, they have no lateral ganglia. They have only collateral ganglia and terminal ganglia. Collateral ganglia is represented by ciliary ganglia, pterygopalatal ganglia, submandibular ganglia and otic ganglia. Ciliary ganglia innervates the ciliary muscles and sphincter pupillae with associated oculomotor nerve, and pterygopalatine ganglia is innervates the parotid gland, a lacrimal gland with associated facial nerve, and submandibular ganglia is innervates the sublingual gland and submandibular gland with associated facial nerve, and otic ganglia is innervates the parotid gland associated with glossopharyngeal nerve. In case of sympathetic nervous systems, one preganglionic fiber is relay or synapse with the 20 or more postganglionic neuron. So they have widespread effects in our body. In case of parasympathetic nervous systems, one preganglionic fiber is relay or synapse with the 21 or 2 postganglionic neuron. They have discrete actions of our body. Now, what is the difference between sympathetic nervous systems and parasympathetic nervous systems? Sympathetic nervous systems is known as thoracolumbar outflow, and parasympathetic nervous systems is known as craniosacral outflow. Sympathetic nervous systems is also known as adrenergic nervous systems, and parasympathetic nervous systems is known as cholinergic systems. Sympathetic nervous system has widespread effects in our body because its one preganglionic fiber is relay or synapse with the 20 or more postganglionic neuron, and parasympathetic nervous system has discrete effect in our body because one preganglionic fiber has relay or synapse with the 1 or 2 postganglionic neuron. It is also known as sympathetic nervous system is also known as adrenergic nervous system because its postganglionic fiber is released noradrenaline, and parasympathetic nervous system is also known as cholinergic system because its postganglionic fiber is released acetylcholine. Sympathetic nervous system is ready of our body for emergency conditions, and parasympathetic nervous system is conserved and restore the energy. Both sympathetic nervous systems and parasympathetic nervous systems has higher center in hypothalamus. Anteromedial part of hypothalamus is control the parasympathetic nervous systems, and posterolateral part of hypothalamus is control the sympathetic nervous systems. What are the effects of autonomic nervous systems in our body? In case of eye, sympathetic action is pupil is dilatation, that means mydriasis, and ciliary muscle is relaxation. Parasympathetic action is pupil is constrictions, that means miosis, and ciliary muscle is contraction. In case of heart, sympathetic nervous system action is increase heart rate, increase force of contraction, increase cardiac output. Parasympathetic action is decrease heart rate, decrease force of contraction, and decrease cardiac output. In case of GIT systems, sympathetic action is peristalsis is decreased, sphincter is contraction, and secretion is decreased, and parasympathetic action is peristalsis is increased, sphincter is relaxation, secretion is increased. In case of kidney, sympathetic action is decreased output and renin secretions, and there is no parasympathetic action into the kidney. In case of urinary bladder, detrusor muscle is relaxations and sphincter is contraction in case of sympathetic nervous system, sympathetic actions, and parasympathetic action is detrusor muscle contraction and sphincter is relaxation. In case of gland, nasal, lacrimal, parotid, gastric, and pancreatic, sympathetic action is vasoconstriction and slight secretions, and parasympathetic action is stimulation of copious secretions